Set, go.
Hello.
Hello.
Hi, I'm Bree. I'm going to be your nurse today.
Nice to meet you.
Good to meet you. I'm just going to be here, do your physical assessment. I want to make sure that everything's good. Do you have any concerns for me today?
No.
All right, so I've washed my hands. I'm going to go ahead and pull that curtain. So allowing for privacy. If the bed is up, I want to make sure that it's down. I want to get this rail down so I have good access to my patient, and I want to make sure that everything is in the room. So I have my blood pressure cuff, I have my thermometer, I have my pulse ox, and I have my pen light. So everything should be ready. I have my stethoscope, everything's good. I'm also in my uniform. I have my badge, scrubs, ready to go, right? Have my watch, good to go. All right, can you confirm your name and birthday for me?
My name is Stephanie Cox, and my birthday is 6/1972.
Perfect, any allergies?
Sulfa and pet dander.
Okay, perfect. So I'm just gonna start with some vitals, make sure everything seems good. Do you have any concerns for me?
No.
Okay, so I'm doing my overall general assessment. I don't see any acute signs of distress, so I can go ahead and start with my normal head to toe assessment because we're probably just doing a nice little checkup, okay? Awesome. So we'll go ahead and start with your blood pressure. Have you had your blood pressure taken before?
Yes.
All right. So I'm just gonna get nice, good round on this. You wanna make sure that this is tight all the way, and you wanna have your stethoscope. First things first, you're going to try to listen for the brachial artery. Make sure you can feel and hear that. So it's right here in this antecubital space. Good. Get this tight. So then when I increase it up, you want to increase it. What is your blood pressure usually?
120/80.
So you want to get it to at least 140. Okay. It popped off, but we're just going to keep going. And then you are going to look at your sphygmomanometer meter right there. Once you hear that sound disappear, then you can pump it up about 20 more. Then you start slowly release this corner here. We're gonna practice that, but you slowly release it and watch your numbers. When you hear that first beep, that's gonna be your systolic pressure. It's gonna beat down, and then once you hear it disappear, that's gonna be your diastolic pressure. So usually it's 120s over 80s or below. Occasionally if you have hypertensive patients, their averages might be something like 180s over 100. You just wanna make sure that you're asking your patient for that. All right, good job. We are gonna move on into, I'm gonna pop this on your finger. Check for your pulse ox. So your pulse ox is just gonna be how well you are being oxygenated. Thank you. And while that is getting its reading, do you mind putting this below your tongue so we can get a temperature?
Don't mind.
All right, thank you. Close around there for me. Alrighty, we have 98.4, so no fever, which is good. Our oxygen sat is at 96. We want that above 95 ideally, so we are good to go. I can take that off of her finger. I'm gonna go ahead and listen to or feel for your pulse. Just gonna put my fingers right here. You want to make sure that you're counting for 30 seconds and then multiplying by 2. All right, for this video's purpose. All right, so I have 18. It would be 36 times 2, 72 is her pulse. And then while you're doing that, you can go ahead and look for the next 30 seconds of that minute at her respirations. And then when you're doing this in practice, you don't say it out loud. For the purpose of this video, we have. All right, so that's gonna be about 16 for her respirations. All right, all your vitals look good. I'm just gonna go ahead and move into our pupil assessment. So I'm making sure that her pupils are equal, round, reactive to light, and accommodating. I'm gonna be approaching from the side and looking for this consensual response. Bright light coming. All right, both pupils are reacting. Check it a couple times. And then if you don't mind following the end of this, eyes converged. So we have our pupils equal, round, reactive to light, and then accommodating. So everything looks really great. I'm gonna go ahead and ask, do you know what year it is?
2020.
Perfect, and then do you know where you are?
Fortis College in Indianapolis, Indiana.
All right, have you noticed any recent changes in memory, concentration, focus?
No.
All right, so then we can move on to the skin assessment. Right now, it looks good. I'm not noticing any lesions. Temperature seems good. Do you mind if I look at your collarbone, get some turgor? So you wanna make sure, no tinting, turgor's good, so it doesn't look like she has any signs of dehydration. Have you noticed any lesions or anything? No. Your body. Okay. So then for the rest of the skin assessment, you're just going to do it as you're working through, but you want to start with that temperature and turgor. So just so you have those two big findings. All right. So now I'm going to go ahead and listen to her heart and front of her chest. So you can kind of bring these two together. When I listen to her heart, I'm going to be looking for 8 to man. What that is your aortic area, your pulmonic area, Erb's point, and then your mitral area. Remember, your mitral area is going to be at the base of that heart, so you can get your apical pulse if you need to get the heart rate through the chest versus the radial pulse, just to make it a little bit easier. Then I'm going to go ahead and listen to her lung fields, both laterally and anteriorly. Then we're going to move forward to the back. That sounds funny. We're going to move forward to the back, have her sit up just so you're not having the patient move around a ton. You want to limit that best you can. All right. Any chest pain, shortness of breath?
No.
Anything like that? No problems with exercise?
No.
Okay. Perfect. Have you noticed any palpitations in your heart?
No.
Okay. So I'm going to start with my aortic. Moving to our pulmonic. Good. Down to Erb's point. Good. And then lastly, our mitral area. It's over here. All right, and I'm not noticing any murmurs, heartbeat sounds normal. So while I'm over here, I'm gonna listen to this lateral side of your lungs. Good, this side. Thank you for taking those nice deep breaths. Any pain with that?
No.
All right, just listening to your lung fields. You wanna start at the top of the lung fields and work your way down, kind of in a zigzag pattern. Good. Now, and remember, when you're listening, you're going to avoid this breast tissue, so you want to go in the spots where there's the least amount, and then you're skipping. Good. And this is going to be at the base of those lungs. Awesome. Now, if you don't mind sitting up for me, I can look into the back of your lungs. Remember, these are kind of called your posterior lung fields. Perfect. Same thing, you're going to listen in a nice zigzag pattern. Do at least 6 spots, maybe up to 8. If you noticed any odd sounds or maybe some crackles, then you want to listen to your lower lung fields again, especially on the lateral side, because if it is something like fluid, that is going to be affected by gravity. So then you can listen to this and see if it's moved and shifted when our patient got up. All right, everything sounds good. If you don't mind laying back for me. Okay, now we're going to move on to the abdominal assessment. Any troubles with the abdomen that you've noticed?
No.
Any heartburn, anything like that?
No.
And then any problems with bowel movements?
No.
All right, awesome. So then you do your normal inspection, and remember, with your abdomen, you're going to move straight to your auscultation because you don't want to change anything with the bobarachmy. Remember those little gurgling that you hear in your abdomen? You want to listen to all 4 quadrants. Remembering that if you don't hear anything in 5 minutes, then you're going to be classifying that as your absent bowel sounds, but we hear nice normal sounds here. Perfect. Awesome. And then you're going to move into your light palpation. Remember, for the purposes of this, you are not doing any sort of deep palpation. We're not trying to elicit any sort of pain in our friends. So just light palpation. Let me know if you have any pain with this. Perfect. Remember, you're just going to move through those 4 quadrants again. No pain, anything like that? Your McBurney point is down here if you're worried about appendicitis. Perfect. Okay, then I'm going to go ahead and move to our extremities. We're going to start in the hands. Do you mind if I see this wrist? I'm just going to assess. So you always want to check bilaterally when you're doing your assessment. At the same time, if there is an abnormality, you're going to start with your normal side. Okay, both of those pulses are the same. Temperature looks good. If I want to assess for additional turgor, I could use the dorsum of this hand. Skin looks good, and then I'm going to do testing muscle strength. So if you could pull against my hands and then push. Perfect. Equal bilaterally, looking good. Any problems that you're noticing with strength? Any weakness?
No.
Hands or legs?
No.
No weakness? Okay. And then you're going to move down and do your pedal pulses. So remember, that's going to be at the top of the foot, usually in between those 2 bones. Okay, those are nice, equal. Same side, rate matches up. Can you pull against my hands? Push against. Perfect. All right, any other concerns that you may have?
No.
Okay, so as I'm finishing up the assessment, if they've ordered the bed rails up, you put those, you open the curtain, She already said she didn't have any other needs. If I needed to push her bedside table, I would bring that back to her, make sure that she has the call light. Here it is. And we're good to go. That's going to be your health assessment.